Tonight we have Mr. Oberg with us. He is a survivor of leukemia. Let's start off with a little bit of background information about leukemia. Leukemia is a cancer of the white blood cells. The cause of leukemia is when white blood cells DNA becomes damaged and abnormal, which in turn causes abnormal growth and development of white blood cells. There are four main types of leukemia. Acute myeloid, which can grow quickly if not properly treated. Acute lymphoblastic, which also progresses quickly. Chronic myeloid, which is usually diagnosed in its chronic phase when the treatment is very effective and helpful. Lastly, there is chronic lymphoblastic, which can progress slowly or quickly, depending on the form it takes. Types of leukemia are named after the two types of cells affected, either myeloid or lymphoid. Cells are also whether the cell is immature or mature. Which type of leukemia were you diagnosed with?
I was diagnosed with acute lymphocytic leukemia, ALL, which is of the two branches, there's the white cells and the red cells, and I had the white cell variety, the acute lymphocytic.
Well, thank you for that extra information. To help try and prevent leukemia, you can limit exposure to risk factors, which include exposure to benzene, which is a liquid in coal tar, and petroleum, smoking. All other risk factors include having a family member or sibling with leukemia, having a genetic disorder which can increase your risk, or having previous radiation or chemo. There are many symptoms for leukemia. Just to list a few, there are fever, fatigue, lumps on neck, underarms, and stomach, paleness, loss of appetite, and bone or joint pain. Which symptoms were you experiencing when you found out you had leukemia?
I thought I had a really bad fever or cold, so I did have those symptoms. And the biggest symptom that I had was chronic fatigue. I was very tired for approximately 6 weeks, to the point where I was actually sleeping at work.
Leukemia is detected through a couple different techniques: physical exams, blood tests, through a biopsy, which is a procedure where samples of cells are removed from the body and tested for cancer, CAT scans, x-rays, and MRIs, just to name a few. Leukemia can be treated through chemo, radiation, drug therapy, bone marrow transplants, or stem cell transplants. How was your case of leukemia detected and treated?
Thankfully, I was treated, and successfully treated, I may add, with chemotherapy. That was about a 4 or 5 month course of very, very toxic medication that put me down like I've never been before. I lost maybe 100 pounds of weight. I went bald twice, and slowly, I regained my strength and my stamina, and I'm here today, 6 years later, as a survivor.
That's awesome news. Sadly, there are side effects from the treatments, which can include hair loss, energy loss, higher infection rate or a lower immune system, bruises or bleeding, nausea, vomiting, and mouth sores. Did you experience any of these side effects after your treatment?
The biggest side effect that I experienced, and I still live with today, is called peripheral neuropathy, where your extremities, your fingers and toes, become a little desensitized or numb. And when my symptoms were very bad, I had a hard time with my fingers picking dimes off the floor. I couldn't pick up a coin or a playing card. That was the worst thing that I dealt with when things were really bad. But now I've been left with just some numbness and tingling in my feet.
That's pretty good for everything that can go wrong. Anything else you would like to add about your experience with the disease?
I had the juvenile form, which is what you see on TV with the children, and it was very rare for me as an adult at 35 years old to get the juvenile form of leukemia. And my doctors did not know how to treat me. They didn't know whether to treat me as a juvenile or give me the adult form medication therapy, treat me as an adult. So I was kind of in no man's land between the two types of therapies. And I think the doctors kind of parsed a little bit out of both sides the two options and treated me that way, and it was very, very successful for me. I was very lucky. I did not need a bone marrow transplant, stem cells. I think I was very, very sensitive to the medication, and it worked for me. So chemotherapy saved my life.
We're so lucky to have you with us today. Well, I believe that's all for tonight. Thank you for joining us, Mr. Oberg. That's a wrap.
Thank you for having me.